Hi, Captain Wayne Bennett here with another quick first aid tip from our One and Done series, teaching you how to save lives in 1 minute. Today's first aid skill is how to treat shock. Since shock is one of the 3 things that you can die from, immediate treatment must be given. So call 911 immediately, get the paramedics on the way. So now what? We've called 911. Most folks are unsure and confused about what to do in the case of shock. So we're going to give you some quick, simple tips that can make a huge difference in your patient's survival. So what is shock and what can we do about it? Shock is a blood flow problem. Quite simply put, a lack of blood flow to the brain. This can be dangerous because brain cells can only live 4 to 6 minutes without oxygen. So the body immediately goes into survival mode. In order for the body to survive, the body has to get more blood to the vital organs. So it begins compensating by taking blood from one organ and giving it to another. It starts by taking blood from the largest organ on the body, the skin. Now that's the good news because the skin cells can live hours without blood flow. But that's also why your patient's going to get cold and pale. The early signs of shock can be anxiety, feeling restless, apprehensive. Then the skin goes cool, pale, clammy, your heart rate increases, breathing becomes rapid, but it becomes very serious when the victim becomes unconscious or unresponsive. Your job is to interrupt or delay the shutdown process by simply placing the victim in the shock position, which is lying the victim down and elevating their feet 6 inches for a child and 12 inches for the adults. This will allow blood from the legs to flow back into the core where all the vital organs are. But your work doesn't stop there. Remember how cold the skin was? Well, we have to cover them up quickly with a blanket. Blood will be sent away from the vital organs and back out to warm up the skin. So use a thermal blanket. It's a bright and shiny surface. It reflects 90% of the victim's heat right back to them. This 6x7 foil blanket will keep the victim nice and toasty, driving blood flow back into the core where it's needed. And one last tip, never leave an unconscious shock victim alone on their back. You must put them in the recovery position on their left side. Of course, that's a great idea for another video. Thanks for watching and please subscribe below. Did you know that 35% of people with traumatic injuries bleed out before they ever even reach a hospital? Learning to control bleeding before the fire engine arrives will become a life-saving skill that your family can't live without. So today's lesson is how to stop bleeding.